Hello. On today's episode, we'll be having a chat with disorders and treatments. I'm your host, Zach Martins, on the Late Psych show. So, how did you classify yourself as a disorder?
I got a psychological symptoms with being infrequent with my behavior, deviant by violating social norms, maladaptive by failing to promote my own survival, and having personal distress.
Ashley, how did you diagnose her with a psychological disorder?
I used the DSM-4-TR by the American Psychiatric Association to determine if she met the criteria, and she did.
So, if she's psycho, how come you didn't put her in a mental institution?
Well, Zach, Felipe Pinel released patients because of how poorly they were being treated.
How would you treat them then?
There are 5 perspectives to explain and treat psychological disorders, such as medical, psychodynamic, behavioral, cognitive, and humanistic.
I see. So, Danny, can you explain to me what anxiety disorders are?
Well, there are 4 different types of anxiety disorders. Panic, which is an extreme discomfort. Oh my god. Oh my god. Phobic is anxiety out of proportion towards stimuli. Oh my god, is that a dog? I can't, oh my god! GAD is always tense and apprehensive, and OCD is obsessions and compulsions. Oh. Okay, I think I'm good. I'm not good. I'm not good. Yeah, no. Drink. Yeah. Great. I think that's good.
Now let's talk about somatoform disorders, where there is no physiological basis but with physical symptoms.
Well, yesterday I thought I had cancer because I couldn't stop coughing, and today I got a nosebleed and I thought I was gonna die. Oh, you have Miss Gilbert at first period? I have a third period.
Isn't she like the best?
I know, I love her so much.
So good. Oh my god, are you okay?
I literally just can't see, like...
What are you talking about? You can
Like,
see fine.
no, I literally can't see anything. Like, I can't even see you. I can hear you, but I can't see you.
What are you talking about?
I swear to God to you, like, I cannot see. Ashley diagnosed me with a hypochondriasis disorder.
Danny also has conversion disorder, where she loses sensation in her hand but has no neurological cause.
I heard that some people can have multiple personalities. What is that all about?
Well, yes, I sometimes get amnesia, which is followed by a stressful event. Also fugue, which is where I run away, change my name, and never look back. To be honest, I probably have like 3 kids somewhere around the world and I don't even know.
One day, Danny swears she's a guy playing video games and enjoying a bag of chips.
I'm totally gonna win.
And then all of a sudden, she'll think she's a 5-year-old coloring.
I draw Zach!
Alright. Well, that's weird. But I want to talk about mood disorders because sometimes I'll see Danny and she's off the walls and having fun, and the next second she'll be crying in a corner.
Okay, first of all, Zach, I have bipolar disorder where I feel hopelessness and depressed, and then I feel overexcited and go in a manic state.
I knew girls were crazy anyways. Ashley, what are the statistics for suicide with people with mood disorders?
The suicide attempts for females are 3 times more likely than males, although males have 3 times more likely successful rate.
So there's nothing that you can do to make yourself happier?
Well, Ashley prescribed me some drugs that should raise my serotonin and norepinephrine levels in my brain.
Those are 2 neurotransmitters that have a large effect on Danny's mood.
I see. So you have told me a lot about certain disorders, but what is considered the most severe one?
Well, only 1% of the population has this disorder. Can you guess what it is?
Oh, me, I know.
You seem to have every disorder name.
Well, that's a little rude to tell someone that has schizophrenia.
Schizophrenia is considered having a split mind from ages 15 to 45.
What is it like to have schizophrenia?
Well, I tend to get a lot of hallucinations and delusions. Sometimes I tend to speak in word salads, and on a bad day, I experience the blunted affect and anhedonia, which are negative symptoms of schizophrenia.
There are 4 common types of schizophrenia known as paranoid, heraphrenic, undifferentiated, and catatonic.
So can you describe what kind of schizophrenia you have?
Well, I have paranoid, so I believe that my FBI agent is always watching me and I hear voices when I'm completely alone. Oh my god, FBI agent, I'm literally not doing anything. Stop watching me. Like, are you kidding me? Like, you need to get out of here. I'm not...
Well, are there any other disorders that we haven't discussed yet?
Yeah, there's personality disorders, which is disruptive, inflexible, and enduring behavior patterns that impairs one's social functioning. Some popular types of the personality disorders are paranoid, histrionic, obsessive-compulsive, antisocial, and borderline.
Previously on the Late Late Psych Show, we discussed psychological disorders. On this episode, we'll be talking about psychological treatments. What kind of therapies are there?
Freud developed the psychoanalytic therapy that can help clients through free association and dream analysis.
How did these help clients?
Well, free association allows clients to say whatever comes to mind, and dreams tell us how they're feeling unconsciously.
Yeah, when I first met Ashley, I would avoid painful topics, which is known as resistance. Although I was very resistant, I didn't go through transference, which is when the relationship with a therapist intensifies.
Is there another type of therapy?
Well, we can do systematic desensitization, which is a 3-step method to treat anxiety.
So with that, Ashley trained me in progressive relaxation, brought up the anxiety-provoking stimuli, and helped me relax.
I tried cognitive behavior therapy to help her with her fear of dogs by making her think about them in a cute and harmless way rather than an aggressive and mean way.
I see. Does she get any kind of reward for trying to overcome her fear of dogs?
Yeah, Ashley gives me chocolate, which are token economies that are rewards that I can trade in later for a chocolate sundae.
I do like chocolate. So, is there a therapy that is less threatening and more open and focused on the client themselves?
Well, we used client-centered therapy, where Ashley showed me empathy, unconditional positive regard, and actively listened and reflected on what I had to say.
There is also therapeutic groups, whether it's family therapy or support groups that make the client more comfortable in opening up to people who share the same issues.
Are there any medical approaches to this?
Yes, benzodiazepines to help calm my anxiety disorders. They're like my sleeping pills. And also antipsychotic drugs such as chlorpromazine to help reduce my psychotic symptoms. Ashley wanted to prescribe me lithium for mood stabilizing, but she was scared I would OD and die.
That wouldn't be good.
That was not good.
So, I've heard of electroshock therapy. Does it work?
It only really helps treat major depression.
Oh. So, Danny, what are you up to nowadays?
Well, after being discharged, Ashley continued with follow-up care, and I've been doing well.
Well, that was a very interesting story you had to tell over these 2 episodes. Thank you for coming on my show and enlightening me. Everyone, please join us next week on the Late Late Psych Show, where we'll be discussing social psychology. Good night, everyone.
Bye. See you later.
See you.